Hi, welcome back to my channel from 10 to Stars. Today, I would like to share a little bit more information about one of the major chemotherapy drugs used in the treatment of colon cancer. Oxaliplatin. So if you're new to my channel, you probably searched up cancer or colon cancer or chemotherapy drugs for colon cancer, and if I popped up, this is me. I was diagnosed a few years back with stage 3 colon cancer, and oxaliplatin is one of the drugs that I took for my chemotherapy treatment alongside with Xeloda. So okay, let's try to make this brief. Also, I am a nurse, and this is one of the drugs that we give. I am an oncology nurse, and I, of course, frequently give chemotherapy drugs, various regimens for the treatment of many types of cancer. Oxaliplatin is one of them, all right? It is a chemotherapy agent. It is what we call an alkylating agent, and it pretty much destroys the DNA strands of cells. And I'm saying cells because chemotherapy drugs, as you all well know, not only attacks the cancer cells, but it also attacks the normal and good cells. So keep that in mind. Chemotherapy, it attacks both the cancer cells, the bad cells, and the good cells, our normal cells. It is a heavy metal. This drug is a metal. It's made of platinum. All right, so oxaliplatin, platinum, FYI. All right, so how is it given? Oxaliplatin only comes in IV form, liquid form that has to go through your veins. So in my case, I had an IV, a needle stuck in through my veins, and I received the drug over a period of 2 hours. For some people, because of the manner of how the regimen is designed to treat the cancer, they have to have a port put in their chest, because they have to go home with a box, a little container filled with a different type of chemotherapy, and they have that drug is being infused over a period usually of 46 hours. All right, so but today we're just going to focus mainly on oxaliplatin. What is it all about? So like I said, number one, it's chemotherapy. So chemotherapy, and then when you come for your first round of chemo, I'm just pretty much gonna share how I talk to my patients when they sit down for the very first time for their treatment. Whenever I give a new drug, a first time chemotherapy or any new drug, I always tell my patients that there is always a risk for an allergic reaction or a hypersensitivity reaction to the drug. And with that being said, I usually just tell them what the signs and symptoms are of an allergic reaction. Number one, if this is your first time to sit down for a type, whatever type of chemotherapy, number one, we watch out for hypersensitivity reactions. Symptoms that include you feel flushed, you once the IV penetrates your veins, your bloodstream, and if after a few minutes you start feeling flushed, you have a scratchy throat. So I've seen patients complain of flank pain in the back. I've seen patients complain first of nausea, and then abdominal cramping, abdominal pain. The later signs and symptom of having a allergic reaction is when you feel like your throat is closing up, or you feel like your tongue is getting bigger. That's kind of like the later sign, or when you're like feeling short of breath. So I usually tell my patients, the moment you start to feel anything different, anything out of the ordinary, as the medication goes through your body, you have to let me know. You have to let your nurse know, because as oncology nurses, we are trained, we know what to keep an eye for. So we know what to do, and we will not know when to act if the patient doesn't tell us. Okay, I've seen patients see, try to tough it up. Like, oh no, it's just this, it's just that. It's gonna go away. Like, please don't. Please be kind to your nurses. Please let us know immediately what you're feeling, especially if it is your first time to get a new medication. Um, I got that out of the way. That's the first thing all of us want to keep an eye on, a patient reacting to a new drug. Okay, so your job is to tell your nurse. Thank you. So, allergic reaction number one. Um, Oxaliplatin is usually, at least in my facility, we give the drug, we infuse the drug over 2 hours. So if you don't want to hang out in the clinic and say, hey nurse, can you please speed up my rate? Like, no, we cannot. There's a reason why we run drugs at a certain rate. We want to keep you safe first and foremost, and usually the rates that are the set rates that the nurses program the drug. There's usually a study backing that up, and how fast, how slow the medications run. So don't tell your nurse to speed it up. All right. Number two, another point is, if you are diabetic and you are getting oxaliplatin as a drug, just be aware that oxaliplatin has to be diluted, or has to run with a fluid with dextrose in it. It is the only compatible fluid for oxaliplatin. So if you're a diabetic, and if you go home and you check your blood sugar, or you go for other types of blood work, and you discover that, ooh, my blood sugar is all the way up there, just be aware that the liquid that oxaliplatin comes in, and the other fluids that go together with oxali, has some component of dextrose. So dextrose, of course, is sugar, and it will increase your blood sugar levels. At the same time, at least also, I will speak for my facility. We also give pre-medications. The medicines that we give before the chemo, we call them pre-meds. They are the ones that either prevents an allergic reaction or nausea. So in our case, we give dexamethasone. So dexamethasone is a steroid. It does wonderful things, and at the same time, it also does some bad things. So in the case, if you are a diabetic, we usually see that their blood sugar, patients' blood sugar usually increase, because we added a little bit of steroid in their regimen. So this is one thing that you just need to pay attention. And if you need to speak with your oncologist about your sugar levels, or your primary care provider about your sugar levels and your medications, then just an FYI. All right, so oxaliplatin, it is compatible only with dextrose. It might increase your blood sugar levels. All right, oxaliplatin is very synonymous to cold sensitivities, okay? Meaning every time, so you get the drug, you leave the infusion center, you go into your car and you crank up your AC, and because it's hot, just like here in California, you want your AC to be just focused on you, on your face, and the next thing you know, you can't you're having some tightness in your throat, or if your arm is in the steering wheel and the AC is blowing into your arm, where in my case I had the IV chemo running through my veins, it will really hurt. It is very bothersome. Now, just a few days ago, I had a patient. He recently had a second cycle, so second dose of his oxaliplatin, and for him, he says it didn't bother his arm, but he noted that the cold air, anything cold, was really bothering him. So cold water, cold air, you touch the fridge, you touch anything cold, you will have cold sensitivities. That's what we call it, cold sensitivities. And some people get it on the first cycle, some don't get it at all. I've seen that happen. And sometimes, and a lot of times, I usually explain to my patient, as you get more and more of the oxaliplatin, the more the sensitivities become noticeable. So the cold sensitivities usually last anywhere from 3 to 5 days. And as the days go by, it slowly dissipates. If you need, of course, we all need to eat and wash our hands, so we just need to wash our hands with tap water. And sometimes when we need to go to the fridge and grab something, some of our patients would use like light gloves so it doesn't irritate the hands. And some people, just like me, I don't care. I just grab. I don't care. What bothered me was, so when I had my chemo, it was during April, May, June, July, around that time. So here in California, it was hot. And I really, during that time, I wanted to drink cold water. And unfortunately, I couldn't. Not even water from the tap. The tap was too cold for me. I had to mix tap water with hot water, more on the hot side, and so I can drink. And I say this because I usually like to emphasize to my patients to hydrate, hydrate, hydrate. The drugs that we give you, they're AKA toxic. There's no other way to explain it. It's a hazardous drug, and it can pretty much dry out your the cells in your body. So if you are drinking enough, try to add a little bit more water to your drinking thing. If you drink 8 glasses of water, and if you are on chemotherapy, and if you're in a place like this in Sacramento, California, where it's really hot, try to add a few more glasses of water if there is no contraindication. Okay, I would like to make that clear. If hydration is the key, Water is still the best, your best friend. You flush those toxins out. The sooner that those chemicals come out of the body, hopefully you're gonna feel a little bit better quicker. We generally tell our patients that chemotherapy, the drug stays in the system for about 48 to 72 hours. So just drink it out, pee it out, flush it out of your system, and hopefully you start to feel better. Okay. um what did I talk about? Oh my gosh. And it's just it's just cold sensitivities, my gosh. But that's the most common complaint about um, complaint side effect of oxaliplatin. Now, one of the other side effects I would like to talk about is peripheral neuropathy. So to cold sensitivity and peripheral neuropathy, for some patients it can be interchanged, but in our case as nurses, we tend to of course we have to look at many side effects differently. So I find that peripheral neuropathy is a little bit more on the it heightens our alert, because the drugs that we give can affect the nerves of your fingers and toes, to the point that it affects functioning. So the term is peripheral neuropathy, where what happens is the fingertips have developed some type of numbness or tingling sensation. The feet, the soles of the feet, or the feet will also have that for some people. And depending on your medical history, if you are a patient who already has some peripheral neuropathy because of some other condition, for example, diabetes or some vascular issues. Vascular meaning you have issues in your veins that that is just interrupting the flow of your nervous system. So if you are already starting with those conditions, and then you get chemo, and then oxaliplatin side effects kick in, this peripheral neuropathy can be very debilitating. When I say debilitating, I mean you are not able to open certain things. You cannot button your buttons or zip your zippers. I've seen a patient complain of not feeling, touching, having sensation when he puts his feet on the floor. So that's a very concerning side effect, and those are the things that you really, really need to tell your provider. Anytime, the cold sensitivity is different in such a way that in a few days your hands will not hurt anymore when you touch cold water. But with peripheral neuropathy, it lingers. And the more that you get the drug oxaliplatin, it worsens. So every time you see your doctor for a checkup, or even before you start your chemotherapy, you just have to mention to the nurse is supposed to ask these questions. Hey, how'd you do the last time? Do you have, what new side effects have happened? And your job as a patient is to just tell. Okay, tell. If you haven't seen your doctor, and if you haven't mentioned to your doctor, mention to your nurse that, hey, I've noticed that I can't open my whatever jar of jam, or I'm dropping things, or I'm having a hard time standing up, or stuff like that. Because I have seen cases where we had to, the chemo is already there, but because there was a good conversation between the nurse and the patient, we had to stop that treatment. And we had to make sure the patient saw the doctor first, because there are times when the patient doesn't see the doctor before the treatment, you know unfortunately. So please always relay information, crucial information. If you're not sure, just say it, just mention it. Don't be too embarrassed to say, oh, peripheral neuropathy is one of those side effects that can take a very long time to go away. And I've heard and seen cases where it doesn't. It just lingers. It lingers. And sometimes I'm beginning, for myself, I don't know if I'm not sure, but sometimes when I sleep at night, my toes get tingly, and I'm laying supine. I'm like, why am my toes feeling like that? So I don't know. In my mind, I'm not stretching enough. There's a kink nerve, whatever. All I'm saying is you need to tell your doctors and your nurses about that very important side effect called peripheral neuropathy. All right. So chemotherapy, like I said, destroys both the cancer cells, the bad cells, and the good cells. I say this, and the next context, the next important thing that we're gonna mention as a side effects is this chemotherapy will affect your blood work. And that is why it is important to get blood work before each and every chemo cycle. We usually at bare minimum, we want a complete blood count, which takes a look at your red blood cells, white blood cells, and your platelets. So complete blood count, CBC, or a CMP, a complete metabolic panel, that takes a look at your kidney function, liver function, bilirubin, potassium, sodium, all that good stuff. So everything, your blood work have to meet a certain criteria before we can proceed with chemotherapy. One of the limiting factors that can affect chemotherapy, meaning one of the blood works that will prevent you from getting chemotherapy, is when your white count is low, your WBC is low. Usually the doctors will either delay the treatment, say, okay, not this week, let's do it next week, no chemo today, we'll do it 1 week later, and we will have to recheck your blood work to see if your white blood cells have gone up. And sometimes the blood cells don't go up, and so it's just a matter of what the doctor wants to do. I've seen doctors add an injection to help boost the white blood cells, and I've seen providers, oncologists, just delay another week and see how and see how the body responds. Everything depends on the individual's medical condition. Okay. And not one patient is going to be the same when it comes to the way that the chemotherapy is being managed. So white blood cells go down, red blood cells go down. The red blood cells are the ones that carry your oxygen. So if you are your hemoglobin is low, then you get more fatigued. You tire easily, you get short of breath. Those are the things that happen when you have a low hemoglobin or red blood cells. Hemoglobin, may I correct myself. And then another component would be the platelets. Platelets is the one that prevents your body from bleeding. So, and chemotherapy can also affect that. So if you notice that you are easily bruising, like this one, bruise around here, see that? I'm taking turmeric, that's probably why. You gotta pay attention to your stool, if there's streaks of blood, if when you pee there's pink, if it's pink in color, if there's little clots, if you blow your nose and there's blood, just pay attention and always report those symptoms to your provider. Okay. What else? So red blood cells, white blood cells, platelets. Oxaliplatin will not, I repeat, will not make you lose your hair. Unlike other chemotherapy drugs where after you receive one treatment, after 2 weeks your hair is gone. Oxaliplatin is not like that. You might notice that you will notice some hair falling off, but it will not make your hair completely fall off in clumps. Okay, what else? Oh, tiredness, loss of appetite. Yeah, all drugs, all chemotherapy does that. Loss of appetite, feeling of being nauseous or sick. It's important. I mentioned this because it's important for you to have nausea and vomiting to be under control, because nowadays, you know, your provider can prescribe medicines that will help keep the nausea and the vomiting well controlled. It has to be well controlled so you can eat, and you need to eat because your body needs nutrition. Yun lang yun. Your body needs to be able to drink. You need nutrition. That's why nausea and vomiting have to be controlled, and that's why you have to report to your provider your symptoms that are not being managed by medication. In my facility, our patients who are not able to tolerate, eating at home, it's just for whatever reason, their oncologists usually call us, hey, can you accommodate this patient for 1 liter of hydration? And also the nurses, we see the patients a lot, so we kind of are able to see the overall health status of the patient. And my colleagues and I, we generally just tell our patients, hey, if you go home and you think that you're not eating well, you're not drinking well, just give us a call so you can come over and we'll give you hydration. Okay, that's an option. And I hope that is also how everything is offered to you in your facility. Inflammation. So oxaliplatin can hurt your vein if you're getting it through an IV. I attest to that. Okay. The one special thing about oxali, okay, so the first dose that we give, we watch out for allergic reaction, right? Specific to oxaliplatin, this platinum drug, when it's time for us to administer the sixth dose or the seventh dose or the eighth dose, six, seven, eight, that's our, we as nurses, when we double check our drug, I usually tell my coworker, hey, this is the sixth dose. We say this because sometimes our patients react to the drug at those cycle on those during those cycles. So dose number 6, dose number 7, dose number 8, we you would think that you're gonna be okay because you've had it for many cycles already, but something about oxaliplatin, and not everyone gets it. I repeat, not everyone reacts on the sixth or seventh or eighth dose, but we have seen patients who have done that. My colleague, she works in a bigger facility. In her previous job, she works in a big cancer center, and she has seen a patient who has received oxaliplatin cycle, she says 22. I'm like, okay. I don't think I have given oxaliplatin cycle 22, but all I know is there are certain patients that will react on cycle 6, 7, and 8. So if you're one of those patients getting that treatment, and in the middle of your infusion you start to feel any different, you start to feel weird, you just have to let your nurse know. Okay. What else? Occasional side effects. I'm reading through the internet right now, so I have a guide on what to be talking about. um no, nothing really. Of course, if you're in your childbearing age, uh, if you're a female in childbearing age, uh, we normally ask for urine specimen to make sure that you're not pregnant, because of course chemotherapy can greatly affect a child that is formed in the womb. Okay. um, Another noticeable side effect that happened for me was after the oxali infusion, when I got home, rested, woke up, and tried to drink water or whatnot, tried to eat, I noticed that I had some really bad jaw pain that probably lingered for just a few seconds, like 3, 5 seconds. And what I did was, when I found out that the jaw pain was very common, not common, that it was happening to me on a more frequent basis, I would just, before I ate anything or drank anything, I would do this. Before I took my first bite or my first drink, I would just do that. I don't know if you've had it. Let me know in the comments below. My one patient that I took care of last week said he noticed that too. So what he started doing was just eating small pretzel, a little bit of pretzel, munch a little bit, and then afterwards it would dissipate, it would disappear, and then he would eat or drink. Another side effect that I noticed was um, there were days when I would become emotional. I would go into this little cry moment when tears would roll down my cheek, somewhere here, I would notice that everything here hurts. This area hurts. So I couldn't cry. Like I have to stop crying because the tears were hurting my eyeballs here, my eye socket. So I don't know if that has happened to you, but that happened to me. Found it weird because I never really read those things in a textbook. And those two things, the jaw pain and the eye pain, I've never read those things in the book, and I don't think I've heard any of my patients mention that to me. So I was like, ah. So ever since I experienced that, I shared that to my patients. Hey, you might have jaw pain, you might have eye pain if you cry, so don't cry. Don't cry when you're going through chemo treatment. I'm kidding. No, you can cry. You're allowed to cry. You're allowed to express your emotions. But whatever, bad emotions you have, like if you feel like the world is ending because you have a diagnosis of cancer, just try not to let that thought linger in your head. Try to kick it away. Just try to flush it out, because now is not the time to wallow in those emotions. You got this, people. You got this. There's so many other people going through cancer diagnosis, cancer treatment. You are not alone. So that's why we're here. That's why I'm doing this. You are not alone. So I wish you all the best as you go through your treatments. Stay strong, and God bless us all.